On this Tuesday night, Quebec's anti-vax tax. A tough new tactic targeting people who refuse to get vaccinated.
They put a very important burden on our healthcare.
Back to school jitters.
We know the virus likes lots of people in indoor settings.
Frayed nerves before 5 more provinces resume in-person learning. A COVID-ravaged First Nation overwhelmed, under-supported, and disappointed with Ottawa.
They did diddly squat, and they have done nothing for this community.
Who's stepping up to help? And saving his bacon.
We've never done this in a human.
The man who has a new heart and a new life thanks to a pig.
Global National with Donna Friesen.
Good evening and thanks for joining us. Quebec's Premier is taking a new approach in the push to convince everyone to get vaccinated against COVID-19. François Legault says those who refuse will face a significant financial penalty. They'll be charged an extra fee for health care. The Premier says only those with a valid medical reason will be exempt from paying. It is clearly aimed at punishing those who choose not to get vaccinated and end up hospitalized. There are now more than 2,700 people in the hospital with the virus in Quebec, the highest number since the pandemic began. About 10% of eligible people in Quebec are unvaccinated, but they take up about half the beds in hospital. The Premier says there are healthcare consequences to not getting vaccinated, and those who make that choice should have to pay. Mike Armstrong explains what the Premier is planning and the reaction it's getting.
Je sens cette grogne.
Quebec's Premier says he's feeling a grumbling in the population, a growing frustration that a small percentage of people refusing to be vaccinated are putting the healthcare system at risk.
I think it's normal that the majority of the population is asking that there be a consequence.
Now, what that's going to mean is a sort of tax, or at least a bill. Anyone who doesn't have an approved medical exemption from being vaccinated will pay what François Legault is calling a health contribution. He says the application's still being worked out, as is the amount. Legault will only say that he wants it to be significant and that
$50 or $100 pour moi.
$50 or $100 for him wouldn't be significant.
I think it will be divisive.
Bioethicist Kerry Bowman calls himself as pro-vaccine as possible. In fact, he calls getting vaccinated an ethical obligation. Protecting the healthcare system and people around you is that important. But Bowman says fining people who refuse to get vaccinated is effectively making vaccines mandatory, something he's against. It may also push people already fighting health measures to even more anger.
I mean, how much civil unrest do you want to create? You know, how many people do you want to alienate?
Obligatory vaccination is clearly a violation of the Charter.
Human rights lawyer Julius Gray says this new health contribution would very likely be challenged in court. The problem is, he says, both sides would have strong arguments. Predicting a winner, he says, would be a toss-up.
It's a very serious violation of individual integrity, but at the same time, there is an argument in favor of putting an end to the pandemic.
They put a very important burden.
Now, one thing the announcement may have done for the Premier is change the headlines. Quebec's National Public Health Director resigned suddenly Monday night. There's also growing frustration over the province-wide curfew. Legault says the government's reviewing whether to lift it next week. Mike Armstrong, Global News, Montreal.
In Ontario, a record number of COVID-positive adults were admitted to hospital ICUs in the past 24 hours. 80 people were admitted yesterday alone, the most in a single day since the pandemic began. There are now 477 people in intensive care in Ontario. More than 3,200 people are in the hospital with the virus, up 753 from yesterday. There is some good news. The Health Minister, Christine Elliott, says patients sick with Omicron are spending fewer days in intensive care than those with Delta.
The length of stay in intensive care units is decreasing slightly, with the median stay currently 7 compared to 20 days during the peak of Delta.
Elliott says 83% of all patients in intensive care in Ontario have COVID-19. Well, the other strain on the hospitals is a shortage of staff. Thousands of healthcare workers are either self-isolating or have quit. Today, Ontario announced it will hire internationally educated nurses to work in hospitals and long-term care facilities which need support. Ontario's health minister says more than 1,200 applicants have already expressed interest in the program. She says they will begin to be matched with hospitals later this week.
All of us are committed to making sure we can give children the best stable environment over the next few weeks that we can, that will remain flexible and adaptable as we have through this.
That is BC's top doctor. She believes kids should be in school, and students in BC went back to class on Monday. Students in most of the rest of the country will return to class next Monday. As the Omicron variant continues to spread, there is debate about the timing of sending kids back to in-person learning. Eric Sorensen reports.
Ontario schools will reopen to some 2 million children starting next Monday. Jana King is a teacher and a mom and is torn.
I know that it's better for my students when we're face-to-face.
But
it's crazy at school. Like, I shouldn't have 30 kids in my classroom.
And she says a lot of kids don't keep their masks on, and not every classroom has proper air filters yet. But with support from pediatricians groups, Ontario is resuming in-person learning because of the harm to kids' mental health from staying home.
We've seen the numbers of mental health needs rising rapidly. We know that it helps students to be in school for their mental and physical health.
Out west, most schools have already reopened. In-person learning is preferred, but how soon depends on the province. In British Columbia, Alberta, and Saskatchewan, schools return to in-class learning this week or last. In the rest of the country, learning is still happening mostly online. But as of January 17th, Manitoba, Ontario, Quebec, PEI, and Nova Scotia plan to reopen classrooms. New Brunswick will stay online at least till the 24th, and Newfoundland and Labrador is still assessing. It's not an easy call.
I don't know what to do, honestly.
On balance, this epidemiologist favors keeping schools closed another couple of weeks.
Anything we do at the societal level that reduces the strain on the hospital system even a little bit is going to have a positive impact.
But this infectious disease expert leans towards opening them.
Instead of saying close schools, why don't we say create safer schools?
Yet he acknowledges in Ontario, there's a risk.
This is the largest sanctioned mass gathering event in the province. Like, you can't ignore the potential for amplification of the virus in this environment.
Schools are just one part of it. As COVID cases skyrocket and hospitalizations climb, many provincial plans are in flux.
We face many more I don't knows and I'm not sures today than we have perhaps at any point in the pandemic journey to now.
Governments will have to be nimble as the Omicron wave grows and up to 5 million children across the country go back to school. Eric Sorensen, Global News, Toronto.
Frustration is mounting tonight in a Northern Ontario First Nation. Last week, it asked for military help to manage a major COVID outbreak. The community says it still has not received what it asked for. Bearskin Lake is a community about 600 kilometers north of Thunder Bay. Nearly half its 400 residents, including the band's chief, tested positive for COVID-19 last week. Quebec also requested military help and got it. Since January 3rd, 200 members of the Canadian Forces have been deployed at Quebec vaccine clinics. Charlie Angus, an MP for Northern Ontario, tweeted today there are those who count in Canada and those who don't. With almost everyone in Bearskin Lake self-isolating, few people are left to chop and haul firewood or deliver food, water, and medicine. As David Akin reports, the community has relied largely on the help of neighbours.
Bearskin Lake First Nation Chief Lefty Kamanawataman was busy late last week pressing Ottawa for help.
That's the message we want to send out to the government. We want boots on the ground right here in the community.
But by Saturday, he, like half of those in his community, had been laid low with COVID.
Nighttime, just sweats and the runny nose and the whole shebang.
The chief was too ill Tuesday for media interviews, but a community spokesman said on the weekend they were disappointed that after asking for as many as 40 military personnel to help run the community on January the 3rd, It was not until January the 9th, Sunday, that the federal government responded, and then with only 6 Army Rangers, at least 3 of which live in the community and are just recovering themselves from COVID.
What Canadians are seeing in the crisis in Bearskin Lake is the systemic indifference from this federal government, the Liberal government, towards the health of Indigenous people.
Meanwhile, others who live in their vast northwestern Ontario neighborhood have pitched in to help.
We want to say thank you to all these neighboring communities that have stepped up to help us.
That aid included this snowmobile convoy, packed with supplies that made the 3-hour trek last week from Big Trout Lake First Nation.
While the disease has been relatively mild to moderate for the community, the fallout in terms of the workforce, the day-to-day operations, that has been brutal on the community.
Indeed, if there's one small blessing, it's that Bearskin Lake and many other First Nations communities in the region had a strong vaccination program in place.
Definitely the situation could have been much worse if it weren't for the high vaccination coverage rates in the community.
As for Ottawa, federal officials continue to monitor the situation in Bearskin Lake and will adjust to conditions. David Akin, Global News, Ottawa.
In Quebec, there are calls for more support for people experiencing homelessness after a man died during a severe cold snap. The 74-year-old was found at an encampment in Montreal last night when temperatures hit minus 26 degrees Celsius. Last January, another man experiencing homelessness in Montreal died in freezing temperatures just steps from a downtown shelter.
It will continue to happen unless we create long-term housing and social housing and low-income housing for vulnerable populations.
Overnight shelters have been asked to revert to pre-pandemic capacities for the next few nights. The Montreal coroner is investigating the man's death. Well, extreme cold warnings are in place in parts of Quebec, Ontario, and New Brunswick tonight. Today in Montreal, the daytime high was about minus 21 degrees Celsius. That's roughly 14 degrees below average. Global News meteorologist Christy Gordon joins us now. Christy, is there some relief in sight?
Donna, we've seen a complete role reversal across Canada. Over the last several weeks, Eastern Canada incredibly mild, barely even feeling like winter, whereas Western Canada extremely cold. Some of the coldest temperatures we've experienced in decades. And now that lobe of Arctic air has shifted east, and they'll likely experience that in eastern sections for the next several weeks, with extreme cold temperatures dropping down to minus 20, some of the coldest conditions they've seen in a couple of years. Now, the big warm up across Western Canada is going to cause some problems. Not only are we going to see a surge in temperatures, rising freezing levels, we've had so much snow in the mountains. That is going to be a problem as well. Intense rain expected over the next 2 days. That rain adds to the snow melt, causing problems. So we're concerned about landslides, mudslides. We're certainly concerned about some flooding in low-lying areas, especially regions that are vulnerable from that storm that we saw back in November. Now, just to give you perspective, the storm we saw in November brought almost double the amount of rain of what we're going to see with this storm coming. So it's certainly not going to be as intense, but it certainly could cause some problems for areas that are still dealing with the damage from that storm in November. Donna.
Okay, Global News meteorologist Christy Gordon, thanks. Fresh pleas to help Afghanistan. Coming up, the UN's new campaign to help Afghans who have next to nothing. Plus, partying like there's no pandemic, Britain's Boris Johnson again accused of breaking the rules, and why robots are delivering food at the Beijing Olympics. There's a new development down under about Novak Djokovic. A new investigation has reportedly been launched that may mean he won't compete in the Australian Open. According to Australian media, border officials are now looking into whether Djokovic made a false declaration on his entry form. Djokovic reportedly said he did not travel in the 14 days before flying from Spain to Australia for the Grand Slam. But social media posts appear to show him in Serbia around Christmas time. Djokovic, who is unvaccinated, won a court battle yesterday to have his visa reinstated and remain in the country. There was a stark warning from the World Health Organization today about what they call the tidal wave of Omicron sweeping across Europe. The WHO says 50% of people in Europe could be infected with Omicron in the next 6 to 8 weeks. And with the sheer number of people getting infected, the health systems are at risk of being overwhelmed. The UN launched its largest aid appeal ever for a single country to try to help stave off a humanitarian disaster in Afghanistan. The UN says nearly $5 billion is needed to help keep basic services running. Afghanistan was thrown into turmoil after the Taliban takeover in August and the retreat of the Americans. Foreign aid payments, which the country long relied on, were frozen. The UN says half the country's population now faces acute hunger.
Without this being funded, there won't be a future. We need this to be done, otherwise there will be outflow, there will be suffering.
In addition to the $4.4 billion needed within Afghanistan, the UN says a further $623 million is needed to help millions of Afghans who fled to other countries. Last month, the Canadian government pledged $56 million to help provide emergency food and other necessities. Ahead, the Bring Your Own Booze party causing big trouble for Boris Johnson.
You're watching Global National.
Britain's Prime Minister is facing the wrath of his own party and the public after a leaked email revealed a party was held in the garden of his residence during lockdown last May. About 100 of his staff were invited. Johnson won't say whether he and his wife attended, but as Crystal Gamansing reports, a string of Conservative MPs have openly expressed anger about the Bring Your Own Booze party.
After reports of a party that was BYOB, today Boris Johnson was MIA.
The Prime Minister has asked for an investigation.
And his government came under fire in Parliament.
The Prime Minister retains the confidence of the people of this country.
Confidence was not what came across in the House of Commons.
I think, Mr. Speaker, his absence speaks volumes, as does his smirks on the media. The public have already drawn their own conclusions.
Several MPs expressed anger, but also pain. Jim Shannon was overcome with grief after explaining his mother-in-law died alone with COVID.
Done decently and within the regulations at the date and at that time. I'm sorry, Mr. Speaker.
A government investigation is already underway into claims government staffers on multiple occasions in 2020 broke COVID-19 rules. The latest gathering in May revealed by British broadcaster ITV News, which obtained a copy of the email invite sent by Johnson's private secretary.
This pandemic for me is a story of two men. So one is my 55-year-old dad, who is dead, having spent 42 nights on a ventilator fighting COVID and no other illnesses. The other is a man who was 55 at the time of this party, Boris Johnson, having survived COVID himself, thought it was appropriate to host a party where you could bring your own booze.
The Prime Minister hasn't said if he attended that party, but MPs on the opposite side of the House will push him on that Wednesday, as the Prime Minister is expected to take questions in Parliament. Crystal Gamansing, Global News, London.
A world's first next, from pig to human, the heart transplant that pushes the boundaries of what's possible. Journalists arriving to cover the Winter Olympics in Beijing are being treated to futuristic food service. These robot carts bring dishes straight to diners, dropping them off from the ceiling. Armies of robots will provide a range of services at the Games as part of pandemic protocols to minimize contact between humans. Well, we know there's a lot of worrying news about our overwhelmed hospitals right now, so we wanted to share some incredible and hopeful news about a medical first. Doctors in Baltimore, Maryland have transplanted a genetically modified pig's heart into a man. It was the only option left to try to save his life. It worked, though it's too soon to say if his body will fully accept the organ. There is a huge shortage of human donor organs, and many people die on the waiting list. Jackson Proskow explains how this transplant could help change that.
You're looking at a medical first, a revolutionary transplant of a pig's heart into a person.
We didn't know what the outcome might be, but it wasn't going to be worse than traditional therapy.
57-year-old David Bennett had no other option. Diagnosed with terminal heart disease, he was too sick to be eligible for a human donation. With less than 6 months to live, doctors in Baltimore offered him a medical leap of faith.
It was very difficult for him to make this decision, but at the end of the day, this was his best hope of getting out of the hospital and having somewhat of a normal quality of life.
The transplant involved a heart from a genetically modified pig with some of its own genes deleted and human genes added to reduce the risk of rejection.
We wouldn't give him a worse outcome, and we had a chance perhaps of striking the good one. He himself said, "I want to live, and if I don't, you'll learn something."
3 days after surgery, the heart is still beating. Bennett is alive.
Transplantation has always been conducted in the context of an organ shortage.
Dr. David Clausen works with UNOS, which coordinates organ sharing in the U.S. If proven, xenotransplantation could ease the critical shortage of donors.
It is an important step, but it still is only a first step, and there will be, a long journey ahead, to see this through.
Animal to human transplants have been tried before. Chimpanzee kidneys, a baboon heart, none successful for more than a few months. Pig organs show more promise. Heart valves from pigs are already widely used. In fact, Bennett received one of those more than a decade before his heart transplant.
He realizes the magnitude of what was done, and he realizes the importance of it.
One man's decision to risk it all has offered hope to thousands that life-saving transplants might one day not involve a life or death wait. Jackson Proskow, Global News, Washington.
And that is Global National for this Tuesday. I'm Donna Friesen. Tonight's Your Canada is Elk Island National Park near Fort Saskatchewan, Alberta. We'd love to see Your Canada. Please email it to viewers@globalnational.com. Thanks for watching. Hope to see you here again tomorrow. Take care of yourselves. Bye-bye.